Welcome to this training video for trophon2, covering how to clean, disinfect, store, and trace an ultrasound probe. trophon2 is an automated ultrasound probe reprocessing system. It ensures consistent and reproducible high-level disinfection, also known as HLD, and is now used throughout all clinical settings where semi-critical and critical ultrasound procedures are carried out. To reduce the risk of cross-infection, it is important to reprocess probes properly between each patient. We will now go through the simple steps involved in effective ultrasound probe reprocessing. Clean, disinfect, store, trace. Cleaning is the essential first step in reprocessing ultrasound probes. It is key to reducing organic material, microbial load, gel, and other soils on the surface of ultrasound probes. Before loading the probe into trophon2, make sure it is clean and dry. Use a trophon companion cleaning wipe to clean the probe, working your way from the cable strain relief up to the tip of the probe. Visually inspect the probe and repeat the process if needed until it is visibly clean. Use a trophon companion drying wipe to ensure the probe is completely dry. Now your probe is clean and dry. Scan the medical instrument tag against the Acu Trace reader until a beep sounds. Load the probe into your trophon2. Start by placing the probe cable strain relief below the cable clamp. Then, pull the probe up into the correct position. The cable clamp will secure the probe in place. Ensure the probe does not contact the chamber wall at any point, and that the tip of the probe is above the embossed line. Next, place a chemical indicator into the locator at the base of the chamber door, red side up. Close the chamber door. Verify that the probe is both clean and dry by selecting Yes on the trophon2 screen. Confirm by tapping your operator card against the Acu Trace reader. Press the Start button. The chamber door will stay locked during the 7-minute disinfection cycle. At the end of the high-level disinfection cycle, trophon2 will beep once to indicate the cycle is complete. Perform hand hygiene and put on a fresh set of gloves. The screen will prompt you to remove the probe and chemical indicator. Open the chamber door to remove the probe. Lightly wipe the probe with a trophon companion drying wipe. Store the probe using a trophon clean ultrasound probe cover. Insert the probe into the probe cover and wrap the securing tie around the cable strain relief. Then place the covered probe in a designated clean area on the bench or console holder. Check the chemical indicator pass status using the color assessment chart. Verify the chemical indicator pass and scan your operator card. Dispose of the chemical indicator and your gloves. The disinfection cycle is now complete and the result is shown on the screen. Press OK and trophon2 will be ready for you for your next disinfection cycle. Acu Trace is an automated HLD traceability system that uses RFID, radio frequency identification technology. trophon2's Acu Trace-enabled accessories and consumables contain RFID chips that store digital information. As you step through the ultrasound probe reprocessing workflow, the built-in Acu Trace reader captures and stores the digital data. Acu Trace simplifies the creation of accurate, audit-ready digital disinfection records and stores over 100,000 records directly on your trophon2. If you have the trophon printer installed, information on the disinfection cycle can be automatically printed out on up to 4 labels. One printed label can be placed on the trophon clean ultrasound probe cover or in the patient's medical record for traceability. Alternatively, the disinfection records can be downloaded onto a USB for record keeping. If you have activated the optional Acu Trace PLUS software, your trophon2 can be integrated with the hospital IT system, allowing all disinfection cycles to be stored and accessed and easily linked to a patient's electronic medical record. To know when to perform high-level disinfection, refer to this diagram in the trophon2 Operation Training Guide or on the Nanosonics website. Applying the correct level of disinfection is based on the procedure the probe is going to be used for on the next patient, as defined by the Spalding classification: non-critical, semi-critical, critical. Trophon is simply smarter high-level disinfection for ultrasound probe reprocessing. Before taking the online quiz, please also review the trophon2 Operation Training Guide document and watch the video again if required. Thank you for joining Nanosonics on our mission to improve the safety of patients, clinics, their staff, and the environment by transforming infection prevention practices.